Berberine is an active compound in a variety of plants that are used in traditional medicine. People claim it's beneficial for diabetes, high cholesterol, and parasite infections. Berberine is the compound that's found in several plants, including barberry, Oregon grape, golden seal, and Chinese gold thread. It has a 3,000-year history of use in traditional Chinese and Indian medicine. Berberine has been studied for heart failure, diarrhea, infections, and other health conditions. Berberine itself has many purported beneficial effects. It's often used for diabetes or cholesterol issues, and some evidence supports this use. A topical application of berberine gel reduced pain and ulcer size in 84 people with canker sores. According to one meta-analysis, berberine may be beneficial in people with type 2 diabetes. In one study, berberine, when taken at 500 milligrams 3 times per day for 3 months, performed similarly to metformin, a diabetes medication also known as glucophage. It reduced the hemoglobin A1C levels, fasting blood glucose following a meal, and triglyceride levels in 36 patients with type 2 diabetes. In the other half of the study, 48 patients with type 2 diabetes treated with berberine had similar results and also reduced plasma insulin. Total cholesterol and LDL decreased as well. In another study, at 1 gram per day, berberine reduced fasting and post-meal blood glucose and the HbA1c levels, triglycerides, total cholesterol, and LDL levels. In rat studies, berberine increased insulin expression, beta cell regeneration, antioxidant activity, and it decreased lipid peroxidation. Based on the existing clinical evidence, berberine may help to control blood sugar in people with type 2 diabetes when used as an add-on to conventional therapy. Scientists have raised numerous hypotheses about the ways in which berberine may help with diabetes on a cellular level, including directly increasing AMPK, which stimulates glucose uptake in the muscles and cells and helps to balance high blood sugar, by delaying the breakdown of carbohydrates into simple sugars, by enhancing glucagon secretion, by mimicking insulin's action by increasing the ability of the body to take up glucose, by decreasing glucose transport through the intestinal lining, and by increasing adipositin, which is a protein which helps regulate blood sugar levels, by activating the blood sugar transport activity of glucose transporter 1, by activating the fatty acid receptor GPR40, by protecting the beta cells of the pancreas against cell death, by inhibiting production of glucose in the liver, by improving the gut microbiota, by inhibiting NF-kappa B, and by increasing insulin receptor expression. Both berberine and a multi-ingredient berberine supplement, when given daily for 4 weeks, reduced total cholesterol, LDL, triglycerides, and increased HDL in 40 subjects with moderate cholesterol issues. In another study with 32 patients with high cholesterol, berberine supplementation for 3 months greatly reduced cholesterol, triglycerides, and LDL cholesterol. Based on lab experiments, scientists believe that berberine might lower the LDL by increasing the activity of the LDL receptor in the liver, by reducing hepatocyte nuclear factor 1 alpha, and by inhibiting lipid synthesis through activation of AMPK. According to a large meta-analysis of clinical research, berberine supplements in combination with conventional therapy reduces systolic blood pressure after 2 months. Berberine, combined with several conventional therapies, increased the quality of life and decreased the death rate of 156 patients with chronic congestive heart failure. Berberine showed potential to improve aspects of cardiovascular health in rat studies. It was also researched for possibly having protective effects on heart muscle cells that were injured by the return of blood flow after blood flow restriction, such as after a stroke. When added to standard drug therapy, berberine might help to lower blood pressure. Some evidence suggests that berberine may improve metabolic health in women with polycystic ovarian syndrome and insulin resistance. In clinical trials, berberine taken for 3 months prior to ovarian stimulation for in vitro fertilization reduced fasting blood sugar, insulin resistance, total cholesterol, LDL cholesterol, triglycerides, testosterone levels, and waist-to-hip ratio. Berberine also increased HDL cholesterol and sex hormone binding globulin in women with polycystic ovarian syndrome and insulin resistance when compared to placebo. Supplementation also appears to improve the lipid status, like the LDL and the total cholesterol, when compared with metformin, which is the standard drug of choice here. In one study, it was as effective as metformin, but with fewer side effects. In another study, it didn't improve outcomes when added to a new drug that stimulates ovulation. According to some clinical studies, berberine may improve metabolic health in women with polycystic ovarian syndrome. Its impact on pregnancy rates is less certain. You can check out my video on polycystic ovarian syndrome for more natural treatment information here. In one study, berberine, taken at 500 milligrams 3 times per day for 3 months, resulted in an average weight loss of 5 pounds, as well as an improvement of triglycerides and cholesterol in obese patients. Berberine, taken at 300 milligrams per day for 12 weeks, reduced BMI and leptin levels, which is a hormone involved in hunger, in patients with metabolic syndrome. Berberine inhibited the production of body fat cells through upregulation of CEBP inhibitor and CHOP and DEC2 in a cell study. Berberine, combined with malaria medication, was more effective against getting rid of the infection than other combination of drugs. The antiparasitic effect of berberine is being researched in anaerobic protozoa, Trichomas vaginalis and Entamoeba histolica, as well as dog roundworm in cell studies. Berberine-containing plants are traditionally used as an anti-diarrhea agent in Chinese and Indian medicine. Berberine was able to inhibit secretions of toxins produced by intestinal bacteria like E. coli and cholera. Some scientists believe that berberine might reduce leaky gut based on research on a mouse model of endotoxemia. It also preferentially increased short-chain fatty acids producing bacteria in rats' guts. Its normalizing effect on gut bacteria was able to improve symptoms of fatty liver disease in mice in another study. Berberine also reduces the damaging effects of TNF-alpha inflammation on the intestinal lining. Berberine may have anti-inflammatory activity. It reduces inflammation of the airways caused by inhalation of cigarette and dust mite allergens in 2 mouse studies. Inflammation of the blood vessels was improved by berberine. It also reduced inflammation of the liver and of fatty tissues in an animal model of non-alcoholic fatty liver disease. Berberine helps with osteoarthritis and rheumatoid arthritis in animal models. Berberine improved learning and memory caused by diabetes in rat studies. Researchers hypothesize that berberine may improve memory by stimulating cholinergic enzyme activity and by reducing inflammation, by preventing the cell death of neurons with reduced blood flow and low oxygen to the brain also. Berberine protected against toxin-induced liver damage in rats via antioxidant effects. It also protected against infection-related liver damage in mice. In rats with ulcerative colitis, berberine reduced inflammation, but it also killed the commensal bacteria in the gut. In another study, berberine reduced inflammation in the gut of mice with colitis and intestinal damage. Scientists believe that it might inhibit lipid peroxidation, intestinal bacteria growth, and NF-kappa B inflammation. Berberine can relieve injury to the kidneys in diabetic rats with kidney issues. Scientists are exploring whether berberine works by inhibiting the NF-kappa B pathway and by inhibiting aldosane reductase and oxidative stress in kidney cells of rats. Berberine increased levels of key neurotransmitters in the hippocampus and the frontal cortex of the brain. Neurotransmitter balance contributes to good mood. A rat study investigated the effects of berberine on depression and anxiety that often follow morphine addictions. You could check out my series of videos on the different neurotransmitters and the different mental health conditions for more information on ways to help improve your mood. Berberine reduced brain cell death in rats that were given strokes via reduced blood flow to the brain. In a cell study, berberine increased levels of enzymes associated with the regulation of inflammation of brain cells. Berberine inhibits proteins that are involved in Alzheimer's disease in cell studies. Berberine creates new mitochondria by increasing SART1 and NAD+ to NADH ratio in rats. You can check out my videos on mitochondrial boosting supplements for more information about this. Scientists are investigating whether berberine has an effect on cancer cells. Berberine is being researched on the following types of cancer: brain cancer, breast cancer, cervical cancer, colon cancer, liver cancer, lymphoma, oral cancer, and thyroid cancer. Repeated doses of berberine inhibit the cytochrome P450 enzyme system in humans, altering the normal breakdown of many drugs. Mild adverse digestive effects were observed among a few subjects in studies such as abdominal discomfort, like nausea, distension, and diarrhea when taking berberine. Typical doses are 500 milligrams taken 3 times per day in the form of berberine hydrochloride. Check out my anti-aging video for information on using berberine, DHEA, and growth hormone to reverse epigenetic aging.